So, welcome everybody. I am so excited to have on Dr. Anne Hussain. Um, Dr. Anne Hussain is in my Clinician Code Mastermind group, and she is a naturopathic doctor and a period literacy advocate. I'm really excited to learn what that means. But when I heard Dr. Hussain talk about women's health and periods and the different cycles of our phase and how we need to treat our bodies differently in order to have hormonal balance, I really opened up my mind and I was like, I need to talk more to her because I've been hormonally sensitive my whole life. So many people that I work with, so many patients that I work with are hormonally sensitive. And as I'm getting older, I'm really realizing how I think we've really had it all wrong to not pay attention to our body's natural rhythm. I think that's why so many of us suffer. And what I want to break down with you today is just that. You know, what is the consequence of not following our rhythms? How can we start to follow our rhythms, and what might that do for us? But before we get there, that just gives everybody some excitement of what we're going to talk about. I'd love to know how you got into this specialization and what is a period literacy advocate.
Thanks so much for having me. How did I get here? So I personally have had a very tumultuous menstrual history myself. I grew up in Pakistan, so my first period ever was there, and it was a complete shock to me because menstrual education, reproductive education in elementary school is not there. Like, it's completely omitted from that. So when I got my first period, it was a complete shock to me. Thought I was, thought there was something seriously wrong with me. I was not prepared. And then my mom explained it to me. And sometimes I get the question, didn't your mom talk to you? But like, that's the culture, right? Like it was taboo. It was hush hush. We don't really talk about it. That's how she grew up as well. She grew up with sisters, so she knew a little bit more than I did, but she didn't know how to have that conversation with me, or that she should have this conversation with me.
Yeah.
So as I grew older, my periods were super irregular always, and eventually trying to get to the bottom of it, my family doctor basically prescribed me a birth control pill and said that this would regulate my period. She didn't really investigate into why I was having irregular cycles or anything like that. And my energy was already low. I also have thalassemia, which is a genetic form of anemia. So she always kind of like chalked it off to low iron, thalassemia, that sort of thing. So when I went on the pill, my energy that was already low tanked further. My mood, which tended to be a little bit low, also tanked. I started gaining weight, started getting acne for the first time. So there's a lot of changes that happened. And, needless to say, I didn't stay on the pill for very long because I felt really crummy. I started getting migraines too, which I had never had. So when I came off of the pill, I told my doctor, and she only offered me more pills. She's like, I can offer you a different birth control pill. And then I had started investigating by this point. I was having master.
Hello.
And I learned that, that the birth control pill has many, nutrient deficiencies that it can create. It can lead to more clots and migraines and other symptoms like that, side effects like that. And considering my family history of cardiovascular disease, I wasn't really a great candidate for it in the first place. And then as I dove deeper, I thought I had PCOS, which is polycystic ovarian syndrome. And when I went to my doctor, we had a discussion, and then we ran some tests, and then I did have PCOS. So I really had to advocate for myself, do a lot of learning on my own, because we don't really learn much about menstrual health or reproductive health. We learn it, you get a period every month. This is what it is. The goal is reproduction, but the goal really is more than that. And the impacts of our menstrual cycle are far reaching. If you've had a period, you know what that's like, right? Like, if you've had a cycle, you know that there's so many fluctuations that happen throughout your cycle. And that really is what period literacy is all about. It's about getting to know what's happening in a menstrual cycle, and more specifically what's happening in your menstrual cycle, because your menstrual cycle probably looks a little bit different than mine. Yes, there's patterns and similarities, but you ultimately will feel a little bit differently than I will. And my one of my missions in life is to my big dreams would be educational reform, if I'm being totally honest.
Yeah, dream big.
But I'm really passionate about teaching any menstruators about their cycle, like what's happening physiologically and how that impacts their health. And we'll dive a little bit more into
Yeah. Yeah. So
that
let's
as we chat.
So let's dive into that. I'm so unbelievably curious. And again, I know probably more than the layperson about, like you said, the typical variations. Most women know that they feel the best in their first week post period, right? So there's got to be something to that.
Yeah.
And then what I hear from most people, especially as they get older, is it's like 1 week is good and the rest suck. Or, 1 to 2 weeks, but definitely the whole second half of a lot of women's cycles they don't feel good. And that's sad, Anne, right? Like it's
Yeah,
sad
for sure.
that most women are living half their life unhappy because of their hormones.
Yeah. Yeah. So, and we have, if we look at the average person who menstruates, they're menstruating for over 300 times in their lives, like 300 cycles for like 30 to 40 years, depending on your genetics and your pregnancy history and other history. Like that's a lot of cycles that we go through without really learning about them and even discussing them appropriately with our healthcare providers, because conventionally speaking, severe pain, take an Advil for it. Hormonal changes throughout the month, your blood work looks normal, right? Like that's the conversation we hear. So we feel like we have to normalize all of these things that we're experiencing when they're not, like, quote unquote normal.
Mm-hmm. Mm-hmm.
Yeah, so if let's break down the menstrual cycle. I'll take you through the menstrual cycle for anyone watching, and then we'll go through like what the common fluctuations are. So when we get our period, that's conventionally, day one of our cycle, and that's because we can see it. I think that's why they determined that as day one, because you can visibly see it, you can't miss it.
Yeah.
That's when your hormones have dipped, so your uterine lining is shedding. So this is, I like to call it, and I know other people have called it this as well, like the winter of the cycle. This is when energy is a little bit lower than normal, and
Mm-hmm.
that's for a few different reasons, right? Like our hormones have dropped to shed that lining, so that has an impact on our energy. And then you're losing blood, so your body has to replenish that blood also, and that's an energetically, um, it uses up energy to create more blood and resources. So
Yeah.
there's that aspect to it. And then a lot of us are iron deficient too, right? Like we're iron deficient, and we tend to need a little bit more sleep at that time, and we don't really change our patterns a whole lot around it. So wintertime, if we think about it, it's the time where we spend a little bit more time indoors. We maybe spend a little bit of more time hibernating,
Mm-hmm.
eating warmer foods and things like that, nourishing foods, like what we call from a Chinese medicine perspective, blood building foods. So that's a great time to do that and honor your cycle, is to take it a little bit slower.
Mm-hmm.
We part of the problem is, I call it patriarchy. Like part of the problem is patriarchy, right? We grow up in this model that's very male, where 24-hour clock, you have testosterone, cortisol peaking in the morning, and then they wane throughout the day. And then in the evening, men have most energy in the morning. And then, at night, they kind of like plop on the couch, the day is done, and then you go to bed, and then you start the cycle anew every day. For people who menstruate, it's similar. Like we have that cortisol spike in the morning, so that wakes us up, gets us going. But then we have this overarching, 20 to 32-ish day cycle, depending on who you are and how long your cycle is, that also has these different fluctuations with hormones doing these dances. And those hormones have an impact on energy, mood, digestion, appetite, how you connect to yourself, how you connect with other people, how you connect with the environment, motivation, like all of those things are
Everything.
impacted. Exactly, right? So yeah, so the going back to the cycle, the first, the menstrual phase when you're actually having your period, that's kind of like the winter. And then you alluded to this earlier, like after your period's done, typically that's when women are like, yes, I feel like myself, I can get things done, let's get going. And that's the spring of the cycle. So sometimes it actually can be even like day 3 of your cycle, like, so you're still having your period or still bleeding, but because hormones have started to rise, right? So your FSH is going up, and then your estrogen is about to go up, and your testosterone is about to go up. So like all of those hormonal changes kind of propel us into spring, when like the buds are blossoming and birds are chirping, and you're like, oh, the sun is out, let me get going now. So that's the spring. We feel a little bit more motivated. We can really tolerate a lot of more fresh foods, as in like our bodies, because of the hormonal changes that are happening, our digestion changes slightly, and because we're not losing blood anymore, we tend to kind of want, or most of us, if you pay attention, like to have more fresh foods at this time, and we kind of crave those foods as well. Because estrogen starts to go up at the end of this phase as well, our appetites are actually a lot better. So this is a great time to create change in your life, because of those hormonal shifts that are happening. You're feeling like yourself. If you want to really build a habit, this is a great time to start whatever habit it is, whether it's around exercise or eating or sleeping or writing, dancing, whatever the case may be. This is a great time to do it.
Hmm.
And then we move into like the summer. So summer is kind of like the area around ovulation. So ovulation happens pretty quickly. It happens within the span of a couple of hours, but around that time, that's their most, from a Chinese medicine perspective, young time. So energy is high. You might even feel a little bit warm. Some people can get a bit of a dip in energy when they ovulate, because it takes a lot of resources in order to ovulate,
Mm-hmm.
but that's usually short-lived. And around that time is, again, that's a great time to, like, it's summertime, get moving, get things done, go hang out with people, communicate your needs, like all of the sorts of things, taking action on things. That's the time to do it. And then we get into fall, and the fall is usually the time frame that's riddled with a lot of problems for people. That's the premenstrual phase, right? Like energy is going down, the sun is going away, the leaves are falling. You're like, oh, it's time to wrap things up so you can. So that's the time where a lot of those premenstrual symptoms will show up. So that could be full blown up PMS or just mild symptoms. But if we look at it from a hormonal perspective, because our hormones have started to decline in order to get to your period, it's actually quite normal to have a little bit more water retention, a little bit more changes in that mood. Maybe, again, we don't want erratic changes, but a little bit is totally fine. Maybe wanting to spend a little bit more time with deeper conversations in that reflection sort of mode. So then after the fall, then we come back to the winter, and that's a great time to rest again. So that's kind of the cyclical change that's happening, and I like to look at that from that perspective of the seasons. Another perspective I like is like productivity. So if we look at it from a project perspective, so like your winter time or period phase would be the time to, do some reading, do some research, take it easy. And then when the spring comes, plan everything out. How are you going to execute? Summertime, ovulation sort of time, that's the time to take action. You execute to the best of your ability, connect with people. And then the fall would be that reflection phase. How did everything go? Let's analyze it. And then the cycle starts anew.
Mm. And so if we normally should be in that sort of fall phase before our period and we don't slow down, what is the consequence? Or what have you seen can be the consequence, right? Because I think most people know, like you said, like first half, second half, okay, I'm ovulating, but they're not really paying attention to where they're at, right? They're not paying attention. And what does that lead to for them?
Yeah. So I always talk about this concept of perpetual productivity. Like we really are a society that is just has normalized perpetual productivity. That we have to be productive all the time. We have to
Yep.
perform at this level all the time, and
Yep.
that really isn't how. Even if we look at nature, I keep looking here because there's beautiful blue sky here. Um, Even if we look at nature, nothing is in perpetual productivity mode, right? Like the moon waxes and wanes, the
True.
seasons ebb and flow, the tides ebb and flow. Like there's all this change happening all the time. And we have to treat ourselves that way too. And when we don't, when we're in that mode of perpetual productivity and not slowing down in the time where our body kind of wants to slow down, or physiologically it's slowing down, but we're not matching it. We're up here and our body's like down here. And there, we created this huge disconnect. And that disconnect usually does show up as more frustration, more irritability, more breast tenderness, more pain and cramping. Because what also happens is then we will over caffeinate because our body's like, I want to go down here, and you're like, but I have to
Mhm.
function up here. So we like over caffeinate, or we sleep, don't get enough rest, or we keep going at the same level, or we, have sugar, or like things that will give us like a quick boost of energy, or quick fixes, whatever those quick fixes might be for
Yeah.
you. For me, for me, it's typically chocolate.
Mhm.
um, which is fine, right? Like a little bit of chocolate brings pleasure in life, but like the overindulgences
Yeah.
that happen at that time, right? Or like having alcohol at the end of the day because you're so riled up,
Yeah.
and then you're having alcohol. And we know, if we look at clinical research, alcohol and coffee, two of the biggest culprits that will exacerbate or worsen your PMS.
Mhm.
So we, instead of slowing down, we basically keep at the same level and add things in that might be exacerbating. So there's a few different factors that come into play, and then obviously that will lead into your period as well. So you might again feel really down because we didn't honor that part of our cycle where we should have slowed down,
Mhm.
and then we have more symptoms, or we have more fatigue, or and it might not happen in one cycle, it might not happen in two cycles, but if that pattern exists, things will show up at some point.
Mhm.
So that's typically what we see. And it doesn't mean, like, we all have schedules, we all have life going on at all times. It's not really, it's nothing,
Yeah. That was
everything's
gonna
gonna
be my
peak.
next question, right?
Yeah.
It's like, how do we, in our fast-paced Toronto, busy, busy, perpetual productivity, I hear you. How do we then, as women, find ourselves again and keep our health and our hormones and still live, in that world?
Yeah. And it's a great question, right? Because and I get it so often, because we have things to do. We have people who depend on us, we have businesses or lives or work that depend on us as well.
Yeah.
So um, I always go back to self-care in this at this point, because self-care, as we know, it's how you can actually refill your cup so you can give more to other people. And without self-care, you can't really do that, right? Like, you can't be your best self if you're not taking care of yourself. And self-care doesn't mean like you have to do a spa day or a massage. Self-care could be anything that you do for yourself that brings pleasure, or that brings joy, or that brings peace. So for me, like a literal cup of tea will is my self-care. A nice walk in the woods, also my self-care. Enjoying a piece of chocolate, lying on the floor doing absolutely nothing, a bath, a shower, like all of those things, exercising at different parts of my cycle, all of those are self-care. So so there's two aspects to that. One is, first you have to figure out, what does your cycle actually look like? How do you feel throughout your cycle? Because like I said, some people feel fairly good throughout their whole cycle, and good for you. Doesn't mean you don't need rest, or you don't need to build in some rest. It just means that your body works a little bit differently. Most of the women I work with personally, they notice like pretty big changes in their energy levels and their output,
Yeah.
and they need a little bit more solitude. I personally am an introvert, and I attract a lot of introverts, I feel. So we need our recharging time for sure. But like I said, everyone does. So if you figure out what your patterns are, energetically, mood wise, connection wise, then you'll start to notice it. We haven't been brought up or taught to do that, right? Like, we haven't been taught to analyze or even pay attention to, how are we feeling throughout our cycles, right? Like, are we feeling a little bit less energetic during our menstrual cycle, like during our flow, and then our energy picks up, and then it kind of ebbs and flows again throughout the rest of our cycle? Or is it constant, right? Because again, the male model is that you kind of feel static throughout the month. So we feel like we should do that, and
Right.
we ignore the actuality, our reality.
Mhm.
So first we need to pay attention to that, and then you can cater that self-care. So going back to that self-care piece, then you can cater your self-care activities um, to how you feel and to your life. So for me, I'm going to give you my example because it's the easiest example to draw on. During my period, typically, I sleep a little bit earlier. because I need extra sleep and I need extra rest. And then what I also do is cook less.
Hmm.
So that could look like ordering in, that could look like delegating it to someone else, that could look like, making a big batch earlier and just like grabbing something from the freezer, because that's like more mental space, like more mental energy for me, and also physical energy that I typically don't have to spend. And that's also the time where I'm like, I just don't want to do it.
Mhm.
Right. So if I don't want to do it, I'm just like, okay, I'm not going to do it. So again, like if that means ordering out for you, and sometimes it might be not be the healthiest of things, but still like there's always like that balance, right? Like maybe you're getting pizza, but at least like you don't have to expend all that energy cooking the
Yeah.
food. And then as I go into my follicular phase, I ramp up my exercise. Like that's what self-care looks like for me. So like ramping up my exercise a little bit, eating more salads and stuff like that, like putting more nutritious foods in my body, spending extra time cooking. So like it kind of balances out at that point in time. And then around ovulation, as the middle of the cycle, again, exercise is a big one that I change because movement is a big form of self-care for me. So like exercise, I ramp it up. I can do more like weights and more like high intensity interval training and stuff like that at that point. Connecting with people, like that's when I'm most social. So like that's when I'll schedule my calls with my girlfriends or catch up with them. Or if I have interviews to do, with other practitioners or things like that that require a lot of my mental focus also, that's when I'll do a lot of that stuff. And then as I go into my premenstrual phase, so like when typically for me it's 4 days before my menstrual cycle, before my period starts, that's when my energy starts dropping down. So up until that point I'm pretty good, but in that time I tend to be like, okay, I'm gonna schedule less things. I'm going to make sure I'm getting into bed on time. I sometimes I journal, or sometimes I schedule time with my husband to just like sit down and we either read together, or we like I'll talk to him about how my month was, how his month was, like that sort of thing. And then the cycle starts anew, and then I'll give him a heads up. Usually like he's pretty familiar with my patterns now because I talk about periods a lot.
Yeah.
So, and that's what the other part, I feel like if you live with other people, like talking about periods is actually really helpful because it makes the other people understand what you're going through. But first you need to understand what you're going through, and
Yeah.
then you can talk to them about it, and they're more compassionate. So like he knows, like when I'm on my period, he's like, do you want me to make you tea? Because he knows that I typically want tea at that time,
Yeah.
or extra tea, or he's like, do you want me to cook today? Right, like they're also involved in that, and then it makes my life easier because I typically have a hard time, and a lot of us, I feel a lot of women have a hard time asking for things. So if we set the stage up so that the other person can be a little bit more involved, I think it's a win-win situation.
Yeah, for sure. For sure.
Yeah.
Amazing. So, you know, have you seen people decrease PMS or hormonal imbalances by paying attention and making these shifts?
Yeah, for sure. So when we start paying attention, we kind of automatically start to do things differently,
Yeah.
right? Like once you know that, oh, I get pain at this point, I'm going to do this, or I tend to not drink water when I do this, I'm going to make sure I bring something. Sometimes we need some guidance, right? And that's kind of, I know you guide a lot of your patients through a lot of different things, and so do I. So like
Yeah.
that's where like people like us really come into play, where we can give the strategies,
Yes.
so that people can pick from. But first, they need to have some self-awareness around what's happening, and then automatically, a lot of people will start to connect the dots, and then we can provide individualized strategies to help them. So a lot of my patients are like, oh my gosh, I never realized that I was constipated before my period. Or
Wow.
I never realized that I get really irritable after I drink my coffee, or like my bowels are really loose during my period when I have my coffee.
Yeah.
So once I start paying attention to that, I'm like, okay, so we're gonna have less coffee during your period so that you don't have such loose stools and things are already moving. And I'm like, and that's also a time when we naturally have a dip in our energy.
Yeah.
So if you need coffee, that's fine, but maybe instead of 2 cups of coffee, we'll do 1 cup of coffee. Right?
Yeah.
It doesn't also mean we never need to eliminate everything. It's usually small changes that we need to make.
Yeah.
Or going back to the other example of constipation, and then we look at food intake at the same time, they're like, yeah, we're generally eating chips and chocolate and other things to say. I'm like, okay, how about, I'm like, we'll keep the chocolate. We can even keep the chips. I'm like, let's increase fiber first, right? Because we know that one of the most beneficial things for PMS is increased fiber. So extra fruits and veggies and extra nuts and seeds at that time go a long way, or even complex carbs
Mhm.
go a long way in mitigating some of those PMS symptoms, because our digestion is typically a little bit more sluggish in that time, right? We tend to retain a little bit more water. Our bowels, that movement that propels our poop forward through our digestive system, it's not as active. So, like, to activate that, we need to make sure we're drinking water and we're having enough fiber in our diets. So oftentimes it's about bringing attention and then giving a simple tool like adding in. So have your chocolate, but maybe have some pumpkin seeds with it,
Also, yeah,
right? Like
totally.
stuff like that.
Doesn't have to be all or nothing. I think though too, when women have acceptance around their bodies changes, a lot can happen too. I know for me, like, I've had PMS my whole life, pretty severe. And, obviously as a naturopath, and I've tried many, many, many things along the way. And what really helped me the most was really what you're talking about, which was acceptance of where I am at the week before, you know, allowing myself to cancel a day or a patient or an afternoon to go home and sleep if I'm premenstrual, not fighting that anymore. I don't fight it anymore. If I
Yeah,
have to cancel or lie down or take a nap because I'm going to get my period in a few days, like, I just do it now.
yeah,
So there's an acceptance though that needs to happen so that we get out of that perpetual productivity of, oh, Jody, just keep going, just push through it. It's fine. You can do it. Of course I can do it.
yeah,
Right? We can all do it.
yeah.
But my body sometimes when I'm premenstrual more so is screaming to sleep. And when I'm premenstrual, I listen more. And I think that over time has honestly helped me more than any remedy, any supplement, any acupuncture, like, truly is letting my body do what it needs to do during that time and sort of following the natural rhythms. So amazing. I thank you so much for everything you've taught and everything you say. Sorry, I felt like going to say one more thing.
I wanted to, yeah, ask you. I'm like, when you didn't used to do that, how is your PMS changing, or like what would it look like before versus now?
I used to fight a lot more with my husband because I think I was in so much pain, emotional pain, that I didn't know how to deal with it and I hated it. So I would like take it out on him. We now never fight ever. I can't remember the last time we fought when I had PMS. And just in general, I think I would always want to be reactive and pick fights with people. Now I just really, I'm with it in my own self and my own skin. I can really be with the pain and the emotions. I also um, I don't hook into the narrative. So I now know, how you were saying, like, we got to know what happens. So I now know that every time I'm PMS, I want to quit my job. I want to divorce my husband. I feel like there's no point anymore. And I love my career, as you do too. But the week before my period, I'm like, no. So I don't hook into that anymore. It's like, okay, this is what my mind does when I'm premenstrual. It doesn't scare me anymore. It doesn't hook me anymore. I know what I need in that place. So that's very helpful. So it's like, I don't judge it anymore or fight it anymore. And in that, it's healed. It's still hard. PMS is a hard time for me. I think it always will be. It's a different time. It's a quieter, more fatigued, more internal, more time. But when I surrender, it's not as difficult to move through.
And that's so powerful, right? Like,
Yeah.
just acknowledging it, understanding where you're at, and then knowing what your patterns are, because ultimately you're the one who has to do them, right? Like knowing your patterns and then moving through that and knowing that it will pass.
Yes.
Um,
Yes.
I'm so happy to hear that you don't fight with your husband anymore.
Well, because as soon as I accepted who I was in my PMS, I let go of so much pain in it, right? When people are in pain and they're not aware of it, they fight with others. Like, right? Like we want to, it's a human thing. Like we want to sort of bring the other person down kind of thing. But now that I can accept myself there, I will say to him, you know, I'm premenstrual, I'm depressed right now, or I'm low mood, or my brain is playing tricks on me and I just need space. Like I'll be really vocal and honest about what it is that I'm feeling versus hiding it and then, you know, letting it out in that way.
Yeah.
And like you said, how your husband knows, like, I think if you're someone who's hormonal, your partner must know because they're part of your life, and hormones, like you said, they change every aspect.
For sure. Yeah, and I would say like anyone living in your house, even if it's kids, right?
Yeah.
Because those are the people you take things out on, right?
Yeah.
Like there's not much filter there.
Yes.
So those are the people who need to know, and it's also a great learning opportunity for everyone, right? We've all been mis and disinformed when it comes to menstruation. This is
Yeah.
a great time to also like educate ourselves and other people and practice that assertive communication muscle, right? Like, and that's what it sounds like you're assertively and proactively explaining what's happening so that you can be yourself
Yeah.
and not fear judgment or not
Yeah.
fear anything else and be on top of that and same thing here. Like I know my energy really crashes on day 1 and 2 of my period, and he knows now. And when we're tired we get more snappy. I definitely
Yeah.
do. I know that, right?
More
Like
reactive, more irritable.
exactly. So now he knows that, if I'm like if he asks a question I'm like and he's like, okay, we'll talk about this later.
Yeah.
Right? So like anything that can be deferred, we defer it. And going back to what we were talking about before, like how in this busy pace of life do we create space for this? Is creating it doesn't mean you create like, hours on and hours on end. Maybe you just need to take 2-3 minutes at the end of the day to wind down a little bit
Yeah.
in the premenstrual phase. Maybe you need to go to bed like 10 minutes, 15 minutes earlier than normal, or
Yeah.
sleep in 5 to 10 minutes later. Or instead of doing like a really, if you're like type A and really into exercise, maybe you just need to take your
Or
exercise
yoga.
a notch. Exactly. Do yoga or do a shorter, like a shorter period of time, or go for a walk. Just take it easy, right? Like it can look like so many different things based on who you are,
Hmm.
but it really is coming back to honoring yourself and also communicating your needs. And everyone's needs will be slightly different.
Yeah. And the community, like even my kids, I have two boys, they're 6 and 3, and no joke, they're gonna be period literacy advocates because I'm not the same mother. You know, the day or two before I'm getting my period, I have no patience for them. I just don't. And so even my 6-year-old, he's getting older, he notices, and I'll say to him, like, mommy's in that place. Like, I don't explain, but she does, just give her space. And I want him to learn that in time I'll be able to say, mommy's PMS, or mommy's before her period. Like, I want him to understand that that's a place for me, and I'm going to be different with him. And in general, not necessarily that he's going to have a girlfriend that, has PMS or whatever, but I want both my boys to understand that females, unlike males, fluctuate, and to sort of listen in, flow with kind of
Yeah.
thing.
Yeah, and it also teaches everybody that we're all in different stages. I feel like it also just gives more perspective and compassion when we're talking to people, right? Like we don't know what's happening in someone else's life.
Yes.
So being more open-minded about that too, regardless of who it is. Like we all at some point will interact with some kind of menstruator, right? Like whether it be a
Yes.
workplace or whether it be at home, whatever the case may be. And I think it's such an important conversation that's just never happened in homes or in school where it really should happen.
Yeah.
And one of the areas that I've really loved researching into recently is looking at menstrual education programs in different parts of the world. And these are areas where there are a lot more cultural taboos or religious taboos that have existed. But when when teachers are trained a little bit better to talk about this, the number of days missed in school goes down.
Wow.
The experience of menstruation changes, which is
Wow.
so incredible, right? Like pain scores go down. The taboos around discussing it with peers goes down, and from both ends, like for even talking about puberty more openly um, with with males, same thing happens. Like their puberty
Wow.
experience also changes. So it's so incredible that how our and you know the power of the mind. I know you do so much work around
Yeah.
that. Like there's so much power and empowerment that can come from this education, and I yeah, that's why that's my dream to do some educational
Don't
research.
do this. Say, that's my dream.
That
We're
is
going to
my
make it happen. Okay.
dream.
That's amazing. It's a beautiful dream because more people, more women, when they go to their doctors at a young age because something's not right and they're just thrown on the pill,
Yeah,
they need to not just be thrown on the pill. They need to start understanding at that point themselves, their bodies, the way their bodies are speaking to them, and learn how to nurture that body into shift, not depend on, you know, a substance to just normalize things. And with your dream, hopefully you can start to make that a reality, because if women understood, themselves more, the complications that happen more, etc., it'll empower them in general to take more natural means, which is our profession as a whole, right? And not depend on, pills and things. So
yeah.
any last message you want to share before we finish?
Um,
And also more about where people can find you and if they want to learn more. And
Yeah, I'll say definitely pay attention to what's happening in your body. I know sometimes there is a big disconnect between, people not wanting to have their periods or wanting to have their periods. Ultimately, if you are a menstruator, I would still encourage you, regardless of what your relationship is with your period, to really figure out what's happening in your body so you can address it more appropriately. The pill, we just talked about it, like it is an okay option for some people, right? Like, but you're right, like it's offered as like an only tool, like it was offered as an only tool to
yeah,
me to fix my period when there wasn't even a thorough investigation. So if you don't feel good, or if you feel like there's something missing in your healthcare, definitely advocate for yourself, because that's what I had to do. I had to diagnose myself and then take it to my doctor. So yeah, definitely pay attention, and then make sure you're leaning into those changes. But first, make sure those changes are normal. We don't want to be leaning into severe or erratic sort of changes, but honoring what your body is going through and feeling. In terms of where to find me, I am very often on Instagram. My handle is dr.annhussain. And then if anyone's interested, I have a free PMS manual. So it has plant-based strategies to support your premenstrual phase so that it's
I
less
need
dependent.
it.
Yeah, so that's annhussain.com/PMS.
Okay, amazing. And I'll share it all when I send this out. Okay. Thank you so much, Anne. That was so, so, so informative. I can't wait to share this with everybody.
Thanks so
Thank
much for
you.